Let's transition over to talking about healthcare in general. The U.S. healthcare system is not without its shortcomings, but it's eminently capable of delivering quality services to consumers, to Americans. The reason the United States ranks so low in healthcare performance compared to other nations is because of access to healthcare, not because of the actual quality of the healthcare services we provide. As a result, Americans underutilize primary care medical services, which results in an increased need for major medical services. Obviously, if you're not going to see your doctor, you're not keeping up, you're not allowing professionals to help you manage your health, you're going to develop more serious problems. And people do that when they try to self-prescribe or cure their illnesses with off-the-counter products. If you're wondering why it takes 6 weeks to get in to see your doctor, it's because there's a major shortage. Nationally, there's a major shortage of primary care physicians. We'll discuss that in more detail as we go forward. There's a segment of the population that thinks government-controlled, single-payer healthcare system is the solution, but that's a hotly contested subject, and personally, it scares the heck out of me. I don't like the idea of the government taking control over our healthcare system. I can't think of anything the government does effectively, especially when it comes to managing money. By nationalizing healthcare, the cost is theoretically spread over the entire taxpayer base. In reality, the government, in their inefficiency, is not going to get as many of those dollars to actually delivering healthcare as we would like to see. I don't want to start a political debate on this subject, but I was in the nutritional health business for a number of years, and I'm actually aware the United States is near the top of the list of most obese countries in the world, which is a problem of our own creation. Providing free health care would not only serve to reduce any personal motivation to manage individual health, much like the war on poverty launched during the Lyndon Johnson administration, pushed record numbers of Americans into poverty. For decades, we've been living in times where technological solutions are dominant. A lot of our problems are solved through technology. So many of our human needs were addressed through technology. As a student of business development, I still strongly think that the capitalistic free market system is especially capable of solving problems such as healthcare access, and at the same time, these principles made our nation the most powerful country in the world, and our government had little involvement in that. We did that on our own. Let's move over to what I consider to be the gatekeeper of our healthcare, and that's the insurance industry. 50% of Americans get their health insurance through their employers. Only actually less than 9% purchase their own medical insurance. The rest are primarily on Medicare, Medicaid, and other government-subsidized programs. If we can agree we have a good healthcare system, but the problem centers around getting affordable access to service, then it's logical to evaluate the expense associated with healthcare and determine what the source of the problem is. Let me ask you a question. Are you aware that if you ask a medical service provider to quote you both an insurance price and a cash price for medical services, the cash price would typically be 40 to 50% lower than the insurance price? Most people I say that to are not surprised. They're like, oh yes, I get that. That's believable. But it's a fact that's well documented. It's also one of the primary reasons the Department of Health and Human Services, the Treasury Department, the Labor Department issued what they call the final rule on transparency and coverage in October of 2020. Health insurance carriers and medical service providers are now required to publish their costs of services for both insurance and cash pay patients. In future episodes, we'll get into more detail as to why the insurance industry has inflated healthcare pricing. They've inflated the price from 80 to 100%. And now it's clear the culprit is the inflated price created by the insurance industry. So what can we do about that? Would seem to be out of our control, but really it's not. Common sense tells us if we can bypass the insurance industry, the cause of the higher pricing, then people need to bypass it and pay cash as a cash pay patient. That may seem a little scary, like a scary alternative, since the average American is not wealthy enough to pay cash for medical services, but that's not how it works. In fact, there's a huge national movement underway to migrate to cash pay medicine. To understand how this works, it's not, there's plenty of resources out there to support people in moving to cash pay.